and Scarborough Center for, based in Scarborough, Scarborough Center for Healthy Communities. Dr. Murshi is the founder of the widely acclaimed Vax Plus Clinic, a groundbreaking initiative that addresses vaccine hesitancy through physician-led phone conversations, and has now broadened to its scope to include cancer screening and demands another question that people maybe have. His work with VaxFast has garnered national media attention and serves as a blueprint for engaging communities in health literacy. Dr. Mushi is a lecturer at the University of Toronto, where he has created a novel health equity curriculum for resident physicians based on the tenet of experimental and transformative pedagogy. He is the founder of the non-profit organization Staff Art for Health, which delivers immersive learning experiences to train healthcare workers in health equity and advocacy. By night, Dr. Murshid showcased his artistic flair as the lead vocalist of the indie alt rock band Parachute Thieves.
Okay, thank you, Mercedes and Hannah. Welcome, everyone. So let's get started. I'm going to now share my screen. Hope this works. How's that looking, Hannah? Yeah, okay. Yeah, I think that should be right. Okay. So today we're going to talk about hepatitis A and B. And just to remind you, I'm Dr. Latif Murji, and I run the Health Vax Clinic, also known as the Vax Plus Clinic. We just evolved our name to reflect our broadened scope. So this is a place where you can ask a physician about any questions about health and learn and be counseled about things that are specific to your health, such as your own conditions or medications, allergies, etc. So without any further ado, we're going to talk about hepatitis today. Hepatitis A and B in particular. There's actually other forms of hepatitis, but these are the topics for today. So what is hepatitis? I think someone needs to mute in case we get feedback like that. Okay, what is hepatitis? Hepatitis, anything with itis is inflammation, okay? And hepat is liver. So this is liver inflammation. And this happens from a number of causes, viruses, toxins, alcohol specifically attacks the liver or damages the liver. So these are different ways that you can get your liver inflamed. And hepatitis A and B specifically are viruses. Okay, they're caused by viruses. This is a disease of the liver caused by these viruses. And they happen to be preventable with vaccines, which cannot be said for every single virus out there or even every hepatitis out there. So the fact that it's preventable with something as simple as a vaccine is a game changer. So a brief overview of the similarities and differences between these two types of hepatitis. So Hep A is spread through food and water. So we call this fecal oral. Okay, so usually there's a contaminated, like something that is contaminated gets, like, for example, the groundwater can be contaminated with feces, and then you could end up like cleaning your vegetables with this groundwater, right? This obviously doesn't happen in places like Canada as much as it happens in other places where sanitation is not as advanced. So in general, Hep A, this is something that's endemic to certain regions. Whereas Hep B is spread through any sort of exchange of bodily fluids. So that could be blood, sexual fluids, giving of birth. There's a lot of fluids exchanged from mother to baby. So it's a very common way that Hep B is spread. Hep A is always acute, never chronic. Okay, acute means short period of time. Chronic is long term. So Hep B, on the other hand, can be acute and can be chronic. There are vaccines for both Hep A and B. So that's the really good news. And then the prevention is the vaccine in both cases, but also hygiene, particularly for Hep B, because as I said, it's transmitted fecal oral. And Hep B, there's safe practices such as safe sex and just being aware of your status and all kinds of things that can make you safe if you had it, but also the vaccine will prevent it. So again, we come back to vaccination. So we just talked a little bit about this. So for Hep A, this is a virus, as I mentioned, and it's spread through the fecal oral route. So that means that small amounts of feces get into the water or get into food, often from hands that are unwashed. Because if you think about it, if we had really good hygiene, then we would be separating these spaces, right? So generally, hygiene is a way to prevent this. But if food or water gets contaminated, then you intake that and then you end up putting this virus into your body. And this kind of thing, if you think about it, it would be more common in a place that's really overcrowded and not good sanitation. So that would be like a refugee camp or a shelter or even a daycare. So these are high risk places. Hep B, on the other hand, is spread through the exchange of bodily fluids. So that could be blood or sexual fluids. Uh, and even babies often are the ones who get this because Hep B is quite common in certain populations, and then mothers pass it to their baby unless there's a prevention put in place for that baby. And often people can have chronic Hep B. Remember, Hep B can be chronic, and then you can have it for years and not know about it because you're not having symptoms, but then your liver is getting damaged over time and you don't know about it. So that's not good. So just to illustrate the transmission a little bit better, and I kind of went through this a little bit. So food workers with dirty hands, this is how you can get Hep A. Like this is a really important reason why we place emphasis on people who are handling food to have really good hand hygiene. Because let's say you're working at a restaurant, and if you don't have good hand hygiene, you can infect so many people eating at that restaurant, right? It's like a mass transmission event. Similarly, let's say there's someone who is a child worker and they're doing a diaper change and they're not doing great hand hygiene because it's fecal oral again. Now, even a tiny amount of this virus on the person's hands or something, later they're preparing snacks for all these infants, and then boom, everyone is exposed to Hep A. So again, this kind of thing happens more in countries that are not as developed in terms of their sanitation practices. However, this kind of thing can happen here too. So it's important to have good hand hygiene anyways, right? Like hepatitis is A and B are just two examples of viruses. There's even other viruses that get passed around. So you want to prevent everything with good hand hygiene. And then Hep B, as I mentioned, like bodily fluids exchange. So IV drug use is an example. That's why if someone is going to be using like needles to inject drugs or anything like that, at least we would want them to do this with clean needles so that they don't also get Hep B and HIV and all kinds of other diseases that can be transmitted through this type of medium, right? So that's why we have this thing called harm reduction. Um, and then, as I mentioned, birth and then even sexual intercourse this is one way you can get Hep B. So another reason to practice safe sex. Also, tattoos. So you want to make sure the like tattoo needles are also clean. So now, in terms of symptoms, what does it look like to have hepatitis? Well, first of all, there's an incubation period. This can be like weeks where you don't have any symptoms, but the virus is in your body and it's starting to replicate. And then you start having a prodromal period. So that's like this fatigue, nausea, vomiting, abdominal pain, particularly in the right upper quadrant. You might have a fever, this kind of thing. These are like general viral illness symptoms, right? So you might think it's like a flu or something like that. We're not sure exactly what it is. And then you start having this icteral phase, which is like jaundice. So, like, your skin and eyes kind of get yellowish, your urine becomes darker, your stool becomes paler, your skin might get itchy. These are signs that your liver is not functioning as well. And then it becomes pretty obvious to some people that this is a liver problem. And hopefully, you would be tested for hepatitis by then and have a diagnosis. Um, but hopefully, you wouldn't get this at all because you'd prevent it with the vaccine and good sanitation practices. So, yeah, this is what it looks like to have acute hepatitis, right? This is just acute, as I mentioned, with chronic Hep B. That's different where you can have it over a longer period of time, and then you wouldn't have these symptoms necessarily in the long run. But this is what acute hepatitis A or B looks like in the first few weeks. Okay, so why does this matter? Well, it sucks to experience any of this in the first place, right? No one wants to get sick. Hepatitis A, as I mentioned, is acute, and usually people will make a full recovery. But that experience that they had with hepatitis is not enjoyable. They're sick, and they can also pass it to others. And of course, there's always some people who don't make a full recovery. It's a small percentage, but those people who are maybe vulnerable, they might be older adults, for example, or immunocompromised people, could have serious damage to their liver in that time. And then Hep B, on the other hand, you might not make a full recovery. Like, you might not clear the virus, and then you have chronic Hep B. And then, as I mentioned, once you have this virus in your system, in the long run, it damages your liver over time, and you can also directly get cancer from hepatitis B, and that would be called hepatocellular carcinoma. And it's another reason why you don't want to get Hep B, because over time, if you just have this virus in you attacking your liver for years and years, this could lead to a cancer. Just like we talked about months ago with HPV, which is another virus that could cause cervical cancer in women. So it's a similar concept. It's better to just not have these viruses and prevent them. And vaccination is one way to do that. So, who is at risk? Well, as I mentioned, hepatitis A outbreaks typically happen in shelters and places that are overcrowded, right? Uh, and in other parts of the world, but they happen here, right? So places that have poorer sanitation are high risk places for hepatitis A, and generally Canada has good public health and sanitation. So we generally don't have Hep A everywhere in Canada, which is why it's safe to drink the tap water in places like Toronto. Hep B, people who are at risk, well, if you're a baby and let's say you're a fetus and your mother has Hep B, well, there's a high chance that when mom gives birth to you, you will get Hep B. However, we have a solution for that, which we will get to. Um, and then Hep B, if you are unvaccinated, you are at risk. So Hep B is something that we would expect you to already be vaccinated for if you are an adult right now. And if you are not, that is something we can rectify ASAP. And then there's other people who already have liver problems. Uh, so like, let's say you have hepatitis C, or you have like you have other liver problems. Let's say you have fatty liver, or um, you had issues with alcohol and now your liver is damaged. Well, all of those different people with livers that are not 100%, if they get hepatitis A or B, that's going to make a bigger difference to their liver, and it's going to cause further damage because it's already not 100%. So that's kind of how everything works, right? Okay, so now vaccines, our favorite thing. So hepatitis A, we have a vaccine for that. It is not a standard vaccine that everyone already has. So there's a bunch of people here today that might not have this vaccine yet. So this vaccine is given in 2 doses. Generally, it's 6 months apart as the interval. When you get your first dose, you're already at 95% coverage. And then the second dose, which is like your booster at 6 months, gets you to basically 100%. And that gives you lifelong immunity. And this is recommended to people when they're going to travel, like overseas typically, or if you're working in a shelter, or if you're someone with liver disease, or if you're MSM. So that's a man who has sex with men, because it's just higher risk. So that's the Hep A vaccine. Okay. There's a Hep B vaccine, which I expect that you would have already, because in Ontario, we give this vaccine to everyone in school in grade 7. So if you're age 10 to 15, you're in the window to get this vaccine, 2 doses, and then you're good. However, if you don't get it before age 15 or 16, if you're 16 and over, then you need to take 3 doses for it to be fully, like for you to be fully covered. Okay. Um, And so, yeah, this is standard in Ontario. There's other provinces and other parts of the world that give this vaccine when a baby is born, like early on in their first year of life. So some people here might have been born in other countries, or their kids might have been born in other countries, and they might already have this Hep B vaccine for when the baby was in their infancy. Uh, and if you still don't have it, and if you're in a high risk group, this is a free vaccine. Okay, and then some people might have heard of this called Twinrix. This is a vaccine. There used to be like commercials on TV about this. Maybe there still are. I just don't watch TV anymore. So this is a combo vaccine. Okay, that's why it's twin. Hep A and Hep B, and it's 3 doses. And generally, this was marketed towards people who are traveling. So you're going to some fun, exciting, warm destination. There's a chance that that place might not have the best sanitation, which means there's a high risk for hepatitis, both A and B, and then get Twinrix, right? So this is a good vaccine if you haven't already been vaccinated. But some people, most people, let's say if they grew up here, they already have Hep B and then they're going to travel, then they just need Hep A. So you don't really need Twinrix, just get the Hep A vaccine because you already are covered for Hep B. Okay, and then this question has the same answer every time because yes, the vaccine is safe. If it wasn't safe, I wouldn't be telling you to get it. And in particular, these vaccines are extra safe because they've been around a really long time. There's no like live component of it. We're not giving you the virus. Like, for example, with the Hep B vaccine, you're just getting the surface antigen, right? So then your immune system sees what the outside of the virus looks like, so that if it ever sees this virus in the future, it detects it very quickly, and then it can mount an immune response. So when you get vaccinated, yes, you will likely have a sore arm. You might feel tired. That's just a sign that your immune system is being activated and preparing a response so that when you actually encounter the virus, you're ready to destroy it. So, very safe. Okay, so is the vaccine painful? Not really. It's like a pinch. Can you eat food and stuff with it? Is there any restrictions? No restrictions. You can eat normally. Does the vaccine cure hepatitis? No, it prevents it. So we want to prevent things before you get infected. That's the point of the vaccine. And that's how all vaccines work. It's not a cure. Um, okay, and then after you get the vaccine, there's no restrictions. You can go about your day as usual. Your arm might be sore, as I mentioned, and this is just to build long-term protection. Generally, when you get these vaccine series, your protection is going to last lifelong. You do not need boosters for these vaccines once you've completed the primary series of either of these vaccines, Hep A or Hep B. So, who is going to be getting these vaccines? As I mentioned, for travelers to endemic areas, that's like most places in the world have Hep A and Hep B endemic. That means that these viruses are like kind of common, right? So basically, first of all, everyone in Canada should be vaccinated to Hep B already. If they're not, you should do that right now. And if you're traveling outside of Canada to most places in the world, those places are going to have Hep A, which means you should get the Hep A vaccine as well if you're traveling. Also, if you're working in a shelter, somewhere overcrowded, somewhere high risk, a daycare, something like that, you should be getting the vaccine as well. And then, of course, if you have any liver diseases, then you should also be really careful around hepatitis and get vaccinated for Hep A and Hep B. Okay, so if you get the vaccine, then can you still get Hep A or Hep B? Theoretically, anything is possible, but basically, if you, as I mentioned, if you get these vaccines, you're fully covered and you can feel very good about that. Like that's the best you can do. And then obviously just wash your hands and practice safe like practices in your life because then that's how you prevent everything, right? Any harmful diseases in general. So this is lifelong immunity. Once you finish the primary series, it is close to 100%. Nothing in life in the whole world is 100%. This is as good as it's going to get. So as I mentioned, Hep B has school clinics. So in grade 7, when you're around 12 years old, you're gonna or your kid is going to get this vaccine in 2 shots at 0 and 6 months. But if they miss that for whatever reason, or if they want to do it in private, like without their friends around, if they're like super nervous or something like that, then they can do it at the family doctor or a travel clinic or a public health clinic. But generally, the best place to do this and what we would encourage, even if there is some hesitancy, is to just get this done in the school because we want this to just be a smooth, normal thing that everyone just does. And that makes it quick and easy. And we don't want to be thinking too hard about these things because these are like definitely good public health interventions that are standard practice. It's like washing your hands after using the bathroom. Just do it. It's not something to think about and decide about. Just it's a routine good thing. Okay. Um, so just a little taste of Hep C for you. Hep C, there is no vaccine for this. Okay. So that as it pertains to what we're talking about today. It just means that if you have Hep C, that means you really want to prevent Hep A and B. So make sure you get vaccinated, uh, and you don't want to be like creating any more damage for your liver. So just get the vaccine, whether or not you have Hep C. So there's different people wearing different hats here today, and something that I think that everyone can play a role in is prevention for yourself and for your community. So the fact that you're here today after work on a weekday, it means that you care about health, you care about prevention, you care about your community, and you have some level of health literacy and or eagerness to learn. And all of those are great. So to play is promoting health literacy and access and information about vaccines, sharing facts, uh, share the VaxFax clinic where they can get the facts and speak to an expert. These are all things that you can do. Uh, and building trust is really important in our communities, remember. So we really appreciate the efforts you all are, because even if you're not necessarily providing information, you building trust and then passing them on to someone has more information, like myself or someone else, can still do a lot of positive for the overall movement, of sharing correct factual information. So just to remind you, this is our link to book an appointment to speak one-on-one with a physician about anything related to health, including vaccines and viruses and medications and medical conditions, etc. So there you go. And thank you very much.
Thank you, Dr. Latif. Very well presentation, simple, easy to understand, no fancy vocabulary word that sometimes is complicated for us to, or for the rest of the community to understand. So I have a question here. So Miranda said, so the symptoms are a bit closer to a flu than a stomach flu per se?
Here, let me stop sharing my screen. Yeah, so as I mentioned, the symptoms. So first you have this uh, incubation period. Okay. So let's say and remember, there's two different viruses, Hep A or Hep B, but generally the symptoms are kind of similar. The incubation period varies a little bit. So let's say for the first, let's say 3-4 weeks on average, you don't really have any symptoms. Okay. So you have this virus, it's building up and replicating within you, and you don't even know that you have it unless you were to test. But why would you test? Because you don't know that you have it unless someone told you that there was an exposure, that you were exposed to them. And that's why public health is very important. But anyways, let's assume that no one told you anything. And so you're going through this incubation period. You don't know that you have it. You don't have any symptoms. Then you start having some symptoms. This is the prodrome period. Yes, this part is similar to another viral illness. What that means is there's vague, non-specific symptoms like fever, right? Fever, everything causes a fever, any sort of infection. Fever is just a sign that your immune system is being activated. So this can cause fever, can cause nausea and vomiting, right? Because it's like your liver is part of your GI system. So if it's like getting inflamed, uh, it's just going to make you feel unwell, right? And so you feel nausea, vomiting, you might feel some abdominal pain. And since your liver is in the right upper quadrant, maybe that pain that you feel is more in that direction, right? So if your liver is inflamed, it's getting a little bit bigger, it's a little bit sensitive. As food is passing by it, it's rubbing against it, it just kind of hurts. right? That makes you feel queasy, you want to throw up, makes you lose your appetite. Those are the types of symptoms that you get in this prodromal period. And then at that time, you might not know you have hepatitis still. You're just thinking maybe you got food poisoning, maybe you got gastroenteritis, like
Mm.
like it could be anything, right? So you don't know. These are all non-specific viral symptoms. And then maybe after a week or so, then you start noticing, oh, like my urine is darker and my stools are paler and my skin is itchy. My skin is like becoming a bit yellowish and my eyes have a bit of yellowish. Well, now if you tell that to a doctor, they would probably figure out pretty quickly that something's wrong with your liver. And then that's when it becomes pretty obvious it's something like hepatitis that's going on because those are liver related symptoms. Does this answer your question?
I think so. Yeah. Okay. So
Yes.
another.
Yeah.
Oh, sorry. Go ahead.
Oh, no, no. I was saying, yeah, I understand. It's the timeline that's like to pay attention to, kind of, and also the symptoms, of course.
Yeah. So did I make the timeline clear for you there?
Yes, yes, yes. Thank you.
No problem.
Another question is if we have to pay for the vaccines, for the A and B vaccines.
Yeah, so as I mentioned, Hep B vaccines are included. That's like grade sevens. Everyone gets it in school. You don't have to pay for it. Hep A is not covered. I believe if you're a high risk group, like you work at a shelter or something, it would be covered. But otherwise, if you're like a normal person,
Mm.
um, you would, and you're like traveling to like India or something, and you want to get the Hep A vaccine, I believe you would have to pay for that. And maybe private insurance would pay for it, but otherwise you would have to pay for the Hep A vaccine.
Yeah, it's correct because I got the vaccine and I pay from my pocket because at the moment I didn't have insurance, but it's a worth investment.
It's
If
definitely worth
you,
it. Yeah.
yeah.
And then once you do it, once you have that vaccine, then you're good for life. So all your other trips, you don't have to worry about Hep A ever again.
Okay, perfect. We have another question here. If you are currently on treatment for hepatitis C, can you still get the Tringy vaccine? If it's not, good hepatitis C treatment be prioritized over A and B vaccination?
Yeah, it's a very specific question. So I actually don't know for sure the answer to this. This is something that would be great to have a appointment about, and we can get the answer. And but my hunch is right now that you can still get the vaccine. I don't really see why not. So yeah, you would be able to get Twinrix while on treatment for Hep C, which is like an antiviral treatment. Um, but again, I don't know 100% because I haven't read about that yet. And that's the type of very specific thing that pertains to very few people. And probably, to be honest, like someone who's on treatment for Hep C would see a hepatologist to get onto treatment for Hep C. And in that initial appointment, they would like probably just vaccinate them for Hep A and B. So like I feel like that would be like a very normal thing that would happen in a consultation by a liver specialist, since that's their bread and butter. However, again, this is something that I can definitely figure out in an appointment with your patient, whoever you're referring to. So that's a good Vax appointment right there.
Thank you so much. So anyone have I don't see any question here in the chat. Anyone want to do a question live? You just raise your hand.
Thank you so much, Dr. Latif, for this very informative presentation. I would like to ask whether you have any idea about the cost of the vaccines, whether they are combo or just hepatitis A or just hepatitis B.
You know what? That's a great question. Let me just, I'll just look it up right now.
In the meantime, we are so excited to announce that we are doing a clinic with Toronto Public Health and Scarborough Network. The first one is going to be next Thursday. I put the flyer in the chat. So for all the kids that they got the letter from the school that they are missing some vaccines, include what better conversation that we're having about the hepatitis vaccine. So if your kid is missing that one, we invite to book an appointment. So this is gonna be for the next week. Yeah, and we're gonna have 3 more in different days and different schedules. So for the old people that are having issue with the time, day, because we need to be safe and we need to be ready for September. So we don't want any kids to miss the school because it's not updated with the vaccines.
Okay, awesome. So firstly, I put the link to VaxFax booking in the chat just to make it easy for everyone. And then to answer Hannah's question and to just reiterate what I said earlier. So in terms of publicly funded vaccination, right? So Hep B, we know, is publicly funded in grade 7. And then if you are a high-risk adult or if you're like an infant whose mother is infected, you're going to get it for free as well. And as I may have mentioned, or I think I said I was going to talk about this, so let me just tell you about this as well. If you're a mother who has Hep B, like chronic Hep B, which is relatively common in other parts of the world, your baby is like going to get Hep B when you give birth unless we treat it immediately. So what we do is there's universal screening for Hep B in pregnancy here in Canada. And then we know everyone who's pregnant who has Hep B, so that when they deliver in the hospital, we immediately give those babies the vaccine and the immunoglobulin within 12 hours. So it's like they're born and then boom, they get it. And this prevents Hep B very effectively in the baby. Okay, so that's why Hep B has a very, very low rate here in Ontario, because we have an effective system for all of this. So anyways, back to what I was saying is that, so those are the situations where Hep B is publicly funded, okay? Now, Hep A is publicly funded for certain high-risk groups, which I did mention earlier. So like in an outbreak situation or at shelters, people with chronic liver disease, those people are all covered, but otherwise, Hep A is typically private pay. So that's either like your private insurance or out of pocket pay. And for an adult dose, it's like around $90. And a child or pediatric dose is around $70. And remember, you need two doses 6 months apart for Hep A. And then if you were private paying for a Hep B dose, it's around $60. And twin Ricks, if you want to get them both at the same time, if you don't have either for some reason, that is also around $90 for an adult dose. So that's like the approximate dollar amounts. Just like think of it as like $100 a dose for everything.
Thank you so much. Also, a question related to that matter that you shared about pregnancy and babies. Let us assume a baby got an immunoglobulin and a first dose of hepatitis B vaccine after birth right away. Will they be in need to have extra doses or booster doses to be protected during, let us say, the first year after the birth?
Yes, they would then get it. They would get a total of 3 doses. So they'd get that dose and then another one a couple months later, and then another one 6 months later. So that would be the protocol for that child or that baby.
And in this case, they will not be in need for, let us say, second round of vaccination when they are in grade 7.
Correct. Yes, then that baby would not need to get the same vaccine in grade 7.
Great, thank you. It's another question regarding hepatitis B as well. What is the percentage of hepatitis B to be chronic after infection?
I don't have that number offhand. So that could be pretty easy to look up as well. Let me just okay, so generally, if an adult gets Hep B, they usually clear it. But if a baby gets Hep B, 9 out of 10 or 90% of them end up becoming chronic. So that's why with newborns, we treat them very aggressively and vaccinate preventively, right? So like immature immune systems in babies are less able to clear the Hep B virus, whereas healthy adults would provide us like a stronger immune response to it. And it's actually like the opposite of Hep A in that sense. So with Hep A in endemic countries, this is like extra information for you, but in case you're curious, like let's say you're in a developing country where there's not that good sanitation, Hep A is being passed around everywhere. A lot of babies get Hep A and then they will clear it and they might not even have symptoms. So a lot of people there are just immune to Hep A, right? Because Hep A does not become chronic. It's an acute illness. So then everyone in that society, you know, this faraway land, everyone's immune to Hep A. But then you are a Canadian who's never left Canada, and now you're 30 years old, and then you don't have a vaccine to Hep A, and then you go and then you have a contaminated thing, and now you get Hep A. Well, you're actually going to have a harder time with Hep A than if you ended up getting it as a baby. So it's the opposite of Hep B in that sense. Which again, all this to say, if you get the vaccine, then none of this matters because you're preventing it.
I hope all babies to be safe, but just another question regarding that. In case they are getting the virus, is there any options for treatment, something like that, or they will be in need for liver transplant, for example?
If they get the which virus?
Yeah, hepatitis B, yeah.
Yeah, if a baby gets Hep B, then they have chronic Hep B. So yeah, like they're not gonna need a transplant necessarily. It's something that that you then have on a chronic basis. And there is actually like a treatment for it to lower the amount of viral like the viral load of hepatitis B that you have. But again, we want to just prevent it from becoming chronic. So if like we know that a baby has it, then we probably know it soon enough that we can actually just like treat it and prevent it right in that moment, right? So we would give the antibody, like the IgG, and we would give the vaccine and put them on the vaccination schedule. So it's like very like unusual for us to know that a baby has it and not know that they were going to get it because we would just test the pregnant women, right? It's like universally done in Canada. So we would always know. And if in doubt, then we would just vaccinate.
Okay, so
For example, I had a hepatitis when I was 40 years old, the A. So doesn't mean that I'm immune I can get again, or I'm immune because already I had many, many years ago. I don't want to say how.
So you're saying you got hepatitis A infection when you're 40?
No, when 4 years old, 4
4. Yeah. So
at home.
yeah, you're fine then, because so you got exposed to the Hep A virus from the actual virus, not from the vaccine.
Hmm.
And fortunately, you didn't get like a severe liver disease from it, right? So now you're in the clear. You are equivalent to someone else who got the Hep A vaccine right now.
Oh, perfect. Thank you.
No problem.
Any question? Any another question? I don't see anyone anymore here in the chat, so I don't know if the people who are there, they want to ask another question. We have a few minutes more. No? I can take a no. Okay. Oh, perfect. We have the webinar feedback, so please feel free to complete the survey. And if you want to participate the gift card, you can put your email address. Thank you so much, Dr. Latif, for your presentation. We know more, so we can educate the community, and also the community can educate themselves. And this is something that is very important as a community worker. It's our role. And anything else? No? You want to say something, Hannah?
Thank you so
Doctor?
much, Dr. Latif, for this very informative session. We look forward for more ones in the upcoming few months.
Yeah. Thanks everyone for having me. I'm excited to for our next talk. We'll see what that ends up being about. It's always fun.
Okay, thank you so much. Have a good evening and show the rest of the day.
Good
Bye.
night, guys.